Why does a squiggle on paper matter so much when it comes to understanding the human heart? Well, those squiggles, known as an electrocardiogram or ECG, reveal the story of the heart's rhythm and health. First, grasp the basics of calibration on an ECG. Each large square on the paper typically represents 10 millimeters in height, which corresponds to 1 millivolt, and 0.2 seconds in width. This standard calibration sets the stage for accurate reading. To determine the heart rate, count the number of QRS complexes within a 6-second strip and multiply by 10. Alternatively, use the 300 method. Divide 300 by the number of large squares between consecutive R waves. Next, assess the heart's rhythm. Measure the intervals between R waves. If these intervals remain consistent, the rhythm is regular. If they vary, the rhythm is irregular. P-wave analysis comes next. Check for the presence and regularity of P-waves before each QRS complex. This indicates that the atria are contracting and leading to ventricular contraction. Also, observe the shape and consistency of the P-waves. The PR interval measures from the start of the P-wave to the start of the QRS complex. A normal PR interval ranges from 0.12 to 0.2 seconds. Moving on to the QRS complex, ensure its duration is less than 0.12 seconds and check for any abnormal shapes or notches. The ST segment follows the S wave and ends at the start of the T wave. It should appear flat. Elevation or depression in this segment can indicate myocardial injury or ischemia, respectively. The T wave should be examined for size, symmetry, and any inversion or abnormal morphology, which can indicate ischemia or other conditions. The QT interval is measured from the start of the QRS complex to the end of the T wave. A prolonged QT interval can indicate a risk for arrhythmias. It's essential to adjust for heart rate using the QTC formula if needed. Lastly, if present, check for U waves following the T wave. Prominent U waves can indicate conditions like hypokalemia. In summary, reading an ECG involves checking the calibration, calculating the heart rate, assessing the rhythm, and analyzing the P-wave, PR interval, QRS complex, ST segment, T-wave, QT interval, and U-wave. Mastery of these steps equips one with the skills to unlock the stories told by the heart's electrical activity, a fundamental skill in both diagnosing and understanding various cardiac conditions. Patient info. Confirmed John Doe, age 45, the 1st of June 2024. Calibration, standard calibration confirmed. Heart rate, 75 BPM, RR interval of 4 large squares. Rhythm, regular rhythm, P waves, present, regular, consistent morphology. PR interval, 0.16 seconds, within normal range. QRS complex, 0.08 seconds, normal morphology. SE segment, no elevation or depression. T wave, normal size and symmetry. QT interval, 0.36 seconds, within normal range. U wave, not prominent. Calculate the heart rate by counting the number of QRS complexes in a 6-second strip and multiplying by 10. Alternatively, use the 300 method by dividing 300 by the number of large squares between 2 consecutive R waves. Heart rhythm, determine if the rhythm is regular or irregular by measuring the intervals between R waves. Regular rhythm, consistent RR intervals. Irregular rhythm, variable RR intervals. P-wave analysis, check for presence and regularity of P-waves. P-wave morphology, shape, and consistency. P-wave before each QRS complex, indicating atrial contraction leading to ventricular contraction. PR interval. Measure the PR interval from the start of the P-wave to the start of the QRS complex. Normal range 0.12, 0.20 seconds. QRS complex. Analyze the QRS complex. Duration should be less than 0.12 seconds. Morphology. Look for any abnormal shapes or notches. ST segment. Check for elevation or depression, which can indicate ischemia, injury, or infarction. ST elevation suggests acute myocardial injury. ST depression suggests ischemia. T-wave. Examine the T-wave for